or self you go now we get the democracy Facebook page. The program now well body talk. They come to you live from the Society for Ready Democracy 98.1 FM. Well, inside the program, I get with me Dr. Fostain James, we now the obstetrician and gynecologist, Department of Obs and Gyne at the University of Salon Teaching Hospital Complex. Good evening and welcome to the program Well Body Talk. Okay, welcome again. I see we don't can the first step. Okay. Well, the program now Well Body Talk, they come to you live from the Society for Ready Democracy 98.1 FM. And inside this edition of the program, we look at fertility challenges, myth, fact, and solution. Well, Dr. James, don't start for look at generally within our fertility.
Okay, Fambude Unadu. So, me na Dr. Fostain James. Me na specialist gynecologist, obstetrician, University of Sierra Leone Teaching Hospital Complex and Cottage Hospital. So, infertility, the way man and woman we done it together for 1 year, then they get regular mommy and daddy business. We say regular, we mean frequently, at least 3 times per week, unprotected, and the woman able get belly. Then they make them infertile.
Okay. So now let's look at waiting the mean way man or woman are fertile.
Yes, so like I explained initially, if woman infertile, let me say, not go able conceive, you not go able take in belly, you not go able get belly. If man infertile, let me say, not go able make woman get belly. So now they say man infertile and female infertile.
Okay, so when they talk about fertility, only gets for do with born?
Yes, so fertility basically it's around born business. We get other areas them way also they touch around that, like where you get belly, they lost the belly, but majorly fertility born business now they talk about.
Okay, so blood type gets any weight we get for do with born pikin and fertility?
So blood type of blood group now they affect fertility. What they affect is it make woman go to miscarry.
Okay.
So you get your own pathway they play.
So that means say if this gets type A or type C.
Yes, so we get what we call blood group incompatibility.
Okay.
That means a different blood group between you and the partner. In terms of the what we call resource type. If that one day no the match, you go get the belly, but the picking go get problem or the belly go get problem. You know they make you not get belly, but what you know more the belly will go get issue go arise during the pregnancy or if you don't born the picking.
Okay, so if una gets the two partner then gets the same type of blood group, or this guy on type blood group and this guy on type of blood group, then go able for born picking?
Yes, so if it's compatible,
how?
Particularly the resource type, so we go to call negative and positive.
Okay.
Okay, generally we go to then call blood group A, B, O. But what's important is the resource type. We're in the positive and negative. You can then say blood group A positive, A negative, B positive, B negative.
Okay.
So if that incompatible, like if the man are positive, then the mommy or the woman are negative, issue the day.
Okay.
But you not go make you not get belly. It will only affect the pregnancy, the belly. Where you don't get the belly, it will affect them. But you not go stop them from making you not get belly.
Okay, so many a times you don't hear say we couple two partner they want for get married, they go hospital for know them blood type for see if they go able for born. So waiting at the different type the way person then go get way go make able for get speaking.
So like I say, the most important aspect of the blood group or the blood type where they check for if you are married, now for know if you are two are positive or negative.
Okay.
So it no matter if the man are A, the woman are O, what's important now the positive and negative. If the like I say, if the man are positive, then the woman are negative, now they the belly will get problem. But like at the end, those parameters in terms of the quality and the quantity will affect the man and ability for impregnate woman. So yes, the sperm nine are a major concern we talk about man fertility.
Okay, so what about some man where they produce plenty sperm but his sperm not able for give woman belly?
Yes, so when we talk about sperm, we talk, like I said, we talk about the.
Continue for the with me na the program in name na Dr. Fostain James in the obstetrician and gynecologist department of obs and gyne at the University of Salon Teaching Hospital Complex. As in there so today for talk about fertility challenges, myth, facts and solution. Remember say yourself where they listen and watch we live na Facebook. You go get chance for be part of the program by why you go send a comment or text message to the number 077981981 or self you go now get the democracy Facebook page. And later on inside the program, we go for open phone line. Usai people go call the number 077981981, ask question about the topic what they do it then at the program. When our fertility challenges, myth, facts and solution as we get the experts in our studio with we. So now let's look at plenty term people can say way you take computer, you put on a lap, it dey work, they affect you sperm counts.
Yes, so there's really not direct relationship with where they put computer or laptop. Now you lap where they work and the quality of your sperm.
Okay.
So waiting basically they happen is that the computer or the laptop they generate heat. Okay, so that heat they affect the sperm production, the process of sperm production. So not like saying that the laptop where they put now the heat where they generate. So if we are in a situation where like there is no heat production by the laptop, or like the place is air conditioned and they actually get heat where they affect that sperm production, the computer not going to make or laptop not going to make his sperm quality poor. It is the heat that is produced from that laptop that actually affects the sperm production process or the quality of the sperm. So yes, so if you look at them in a way, it will affect. It will affect.
Okay.
But not like saying that the laptop, we put laptop now, the foot there, it affects. No, it's the heat. Sometimes they produce like serious heat will go affect the sperm production or the quality of his sperm. So when they put the problem by the human, everybody just takes it like that.
Okay, the program now will body talk. They come to you live from the Society for Ready Democracy 98.1 FM. You self can be part of the program by way go send a comment or text message to the number 077981981, 077981981 and the number for sending the comments or text message on the program. And later on we get for open phone line outside people go call and ask question about the topic what they do with today. When fertility challenges, myth, facts and solution as we get the experts in the studio with we when Dr. Fostain James in the obstetrician and gynecologist department of obs and gyne University of Salon Teaching Hospital Complex. So that could all look at some of the different things them we can cause infertility. So now let's look at what can be the cause of infertility per man.
Okay, so like I say, number one, the sperm.
Okay.
We'll talk about sperm. We'll talk about abnormalities in the sperm. Anything where they make the sperm abnormal. The one thing where they make sperm abnormal are the quantity. Okay. Then we get the quality. I will talk about that initially. So for the quantity, anytime when man and woman they get that business, there's an amount of volume of sperm where the man for release for make woman get belly. If that quantity they not in the man release, the woman will get belly. So for example, we were there at the field, we know the number, the figure. Where that figure they at least there's an amount of sperm quantity where na in need for come out for the woman get belly. But that sperm quantity where they come out, there's an amount of sperm cells them wait for them inside it, wait for make the woman get belly. So you go find out something the man the sperm will come out but the actual sperm cells the way they wait for make woman get belly, they not reach the optimal amount, like the normal way for it for let woman get belly. So that is in terms of the quantity. Quality I don't talk about ability for let the sperm swim, for let move go before, for let they alive, for let get normal shape. So those are the things that affect male infertility. So then are just for the sperm. We also get what we call hormones. Hormones are chemical in our body. Where they make the body function, how they function. So as woman and as man, the man get your hormones then, majorly testosterone. That one they also they play part for make the sperm produce. So if you don't get that for some reason, any reason you don't get that testosterone, that hormones there in the right amount, the sperm production will be affected, and as a result, the sperm counts go low. Okay. Also, some people that's so them born them.
Okay.
Okay. There are people we get we get some things that we call undescended testes. So the man parts, in testicle or in the balls. Sometimes they not form well.
So which means then type of people not able for born
Yes,
picking.
because part of what they produce the sperm now you testes.
Okay.
So if that they not form well or can't know say for day, it is say once one ball's empty, the other one so that one can one or two no they in the sack. Okay. So if that they happen, they affect also sperm production. So basically anything that affects sperm production. Some people they'll be the one that go operation. Okay. So when sperm they produce, it get passage, it gets away the passage for come out by the woman. So during the operation, if they operate you, then a mistake tight, that would be that sperm. You will produce the sperm, but you know come out.
Okay.
To be inside there. So essentially, you will get the intercourse, but you know they produce no sperm. Or you will make the woman get belly. Okay. So now some of the things that they cause male infertility.
Okay, so now let's look at waiting at some of the things they get where they cause infertility per woman.
Yeah, so the woman, your own partner, get more causes.
Yeah.
So for make we understand waiting the cause infertility per woman, we need to understand the parts that we by the woman.
Okay.
So one of the main important parts that we all know that the womb, inside the picking the laid up. We also know about the tubes. The tubes and outside the egg and the sperm, then they pass and outside they meet up.
Okay.
Okay. Then are the tubes. Then we get the ovary. The ovary now the thing that will they produce the egg. Every month, every woman they release egg. That egg they now the ovary they come out. Okay. So that thing I don't call the womb, the tube, and the ovary. If they want to get problem, anyone can get problem, it affect the woman. It will make in one will be problem. Okay. So with that, some of the things the way they affect the womb, we will make woman able to conceive. Okay. So if the woman get fibroids, okay, fibroids the way big or way they inside the womb, inside the picking for go lay down, that they don't go occupy. It go difficult for the woman to get belly. Okay. Then for the tubes are the passage. We say the egg the pass, the sperm the pass for them to up and fertilize. If down there they block, particularly for 2 block, no matter what you do, you know get belly because the egg and the sperm they know they meet up.
Okay.
For leg picking form, the egg and the sperm they for meet and fertilization occur for leg picking form. But if them 2 they don't block, nothing not go make it get belly. That's a problem they solve. Then we go to call for the ovary. We go to call ovulation. Where I say every month, every woman for release egg, we for make with the sperm be fertilized and get pregnancy. So if you know they release egg, you know they ovulate basically. Like you know they ovulate, or you get problem with your ovulation, it will be difficult for you to get belly. Because if egg not there, like the sperm count, and the sperm come, you not get nothing for fertilize. So the woman need for the ovulate every month. Okay? So that's some of the things and there's some sickness neighbor per woman they get.
Okay, so we can look at the secret way woman they get we go tap and for making able for born picking. So now you mentioned one part in the way you mentioned you say the tubes them if them block. So what think can cause for let the tubes thinking block per woman?
So now we setting or generally one of the commonest causes that for let woman in tubes and block.
Okay.
Infection, also called PID, pelvic inflammatory disease. So if woman they get repeated or recurrent infection, all time they get infection, you go you treat yourself, you go to pharmacy, you buy medicine, you treat yourself. So if they reach a point, that infection they get, they ascend. We call and say ascend, they go up. Okay? Sometimes they start at the vagina, go up, say go to the tube, go other parts there. So that one day whether infection they go to that part say by your body, and that tube they well. But they well and they form scar, what we call fibrosis. Okay. So now they happen frequently, they make the tube, they reach a point, they block. So
okay.
They what we call fibrosis or scarring inside it. So repeated infection per woman, they lead to making tubes and block.
Okay, so now let's look at again the difference in them with the different sickness where they cause infertility per woman.
Okay, so one of them we common, I would call PCOS, polycystic ovarian syndrome. Now sick we also get for where they affect woman, we get for deal with hormones, other parts of my body. You can see the woman that we can get big body. Okay, like basically the body big, and some even get beards on face. Woman where they get anything and they, and even the hair distribution and body different. So if you see person again kind presentation and that kind of features as woman, then also if they get problem with in menstruation. So and they like every 3 months they mess, or after every 6 months they mess. They mess every month basically. And then also if you check in body for them chemical have been called, you see say the man hormone testosterone is high. But my woman but you get high levels of man hormone and testosterone. So if any woman will present to anything and they get problem with in period, they get like features of way fiber man, they get abnormality in chemical within in body, the hormones there, and the other person they get what we call PCOS. So that one they affect the born one because already they get problem with menstruation.
Okay.
And then menstruation and ovulation you get abnormal before you get belly. Okay. Another thing we can affect woman in born one when are sick, called endometriosis.
What's in Andy?
Endometriosis basically now we but the woman in womb we get different parts there. We get the inside of the womb, inside the bikini we call it endometrium. If that part stay for any reason like it shed off, it commodity, it go for the other side. That inside by the womb, it go the other side. It cause problem for the woman. It cause problem for the woman. Okay. For example, if that party come out inside the womb, it go find itself inside the belly, for example, or it go for the ovary. It cause problem. Okay. As it cause problem, it affects ovulation business. It affects even the egg in pass one for the kind of the tube. So any sick where they affect ovulation, they also affect the one. So endometriosis is one of them. PCOS is another one.
Okay.
Yes.
Okay, is it true that any woman we engage in sports safe they get challenge for making be fertile?
Yes, so we not directly relate women in sport and infertility.
Okay.
So what
because
happens,
you mentioned say woman we get beers,
yes,
big body and other one them.
yes. So but women they involved in sport not get beers.
But
Yes,
their body structure can
yes,
also
so
feel
what
like
happens
man.
is
So.
that women them way they involve in sport, they do a lot of exercise.
Okay.
A lot of exercise on the extreme. Okay, so what happens is that when you do that, when you like you are doing a lot of exercise as a woman, it affect your menstruation, it affect your ovulation. Okay, think in case of the incident period.
Okay.
Yes, the one that they run then long distance within serious sports, then they can need mess. It's not because they're a man, and because of the exercise they're exposed to. Because of that exercise, they affect the hormones in your body. Okay, we go to call the HPD hypothalamus, pituitary and ovarian axis. Sober exercise they affect that part in your body, and when that part is affected, they affect the hormones that we for make you ovulate, that we for make you get belly. So we woman would into serious sport like that, they run a long distance or we don't the exercise for long. It can also keep business.
Okay.
Yeah.
So what about the man there?
So in fact, on the contrary or the reverse, is that man the way involved in exercise, they produce a lot of testosterone,
Okay.
which is good for sperm production. So man for exercise is good. Okay, that don't mean woman not for exercise. We talk about extreme
Exercise.
yes.
Okay.
Yeah.
Okay, continue for the with me at the program. A name now Dr. Fostain James, obstetrician and gynecologist, Department of Obs and Gyne at the University of Salon Teaching Hospital Complex. As in there, so today for talk about fertility challenge, myth, facts and solution. The program now well body talk. They come to a live from the Society for Ready Democracy 98.1 FM, and where they bring this edition of the program well body talk. My name is Karifa to Conte. Remember, say yourself where they listen and watch we live on Facebook. You will get chance for be part of the program by way you go send a comment or text message to the number 077921981, or self you go now get the Democracy Facebook page. Well, anytime from now we do open the phone line. Also, people go call the number 077921981, 0798291 at the number for call. Ask question about the topic what they do it then at the program.